I'm Jocelyn, one of the OET aspirants from Edu Skills International. I would like to thank Father Salim Joseph and all admin panel. Here I am to introduce listening part A. Yes, now we are going to deal with listening part A. Listening part A has three parts, as you know, total of 42 questions. And according to Father's strategy, we need to aim grade A. Listening test has two consultation. There is 12 questions each, and each for 5 minutes. This listening part A has two consultation. So this is an interview. There's a conversation between healthcare professional and a patient, and you need to look for specific details. And usually, most often, we can see that answers will be from the mouth of the patient, not from the healthcare professional. Starting of the test, you need to read the question carefully and use the word exactly as it is given in the audio, and do not paraphrase or change the word form. Write exactly as it is mentioned in the audio script. First, this listening part A, it will start with introduction. They will talk, and then they will come into our point, which is given in the booklet. This context, there might be a context based statement what we need to write, and this we will be coming to know who is speaking and to whom, and what is the name of the patient, and what is the designation profession of the healthcare professional. This and all will be denoted in the audio script. So when we are coming to the father strategy, when we are applying, we need to have a prediction or anticipation when you're going through the question script, and then beware of paraphrasing. Usually, paraphrasing is done in audio script, but you have to write it as it is mentioned in the audio script. And beware of synonyms, beware of collective words. When you are listening, you need to look for body parts, adjectives, medical condition, which medical condition is dealt, and then medicine, symptoms, negative expressions, and sequential sequence like first you, second you, and such as that, and cause and effect language, procedures, and then informatives or a daily activities, what the patient is doing, and person presumption. Hope you have got an outline about part A in listening. Thank you.
Okay, thank you, Ms. Jocelyn, for your nice explanation regarding the introduction part. She has well explained about our father's strategies and how to read and how to predict the answers. Everything she has explained well. Then I call upon Sudha Narayana Swami for dealing the first three questions. Welcome, Sudha.
Good evening, all. My name is Sudha. I am one of the OET aspirants in the Edu Skill family. First, I would like to thank our father, and then our admin members, and then Arya ma'am. And then I extend my special thanks to Miss Helen, who was the one made me to present this presentation today. Thank you. While during that golden 30 minutes, first we should foreseeing the things. First, check for the conversation between to whom. Here the conversation between rheumatologist and then patient named Harry Davis. The first thing is, while the conversation, for what are all the things we should watch means, one thing is, first the patient is verbalizing that first is the time marker, and then followed by that the pain in his. So father told no, this listen for, here the dash, while seeing the things before the dash and then after the dash we should watch. Here the patient is verbalizing accompanied by pain, swelling, that. So here the first dash may be some body part. While listening the things should listen for either patient is telling right side or left side. We should be careful in that. Then next one is The followed the conversation he described as initially. Initially is the sequential expression. And then next one is possibly. Possibly related to medical taken for. Taken for means they received some medication and then it must be filled with that things. The gap pain in his the body parts is filled with knee, and then patient is explained that he had the pain plus swelling, and then he thought the second gap is filled with an insect bite. The third one is he is taking the medication for cholesterol. That gap is filled with these three dash.
Anyway,
Okay,
thank you,
ma'am.
Sudha.
Thank you, ma'am.
Yeah.
Thank you, Sudha, for your nice explanation about first, second, and third question. She has well explained about the time marker, sequential expression, and the possibility. Thank you, Sudha, once again. Then I would like to call upon Divya to handle the next three questions.
Good evening, everyone. My name is Divya, one of the OET aspirant in Edu Skills International. First of all, I would like to thank Father and all the admins who gave this opportunity to me and for this valuable their time to explain this and handle me this three questions. Next, question number 5 was unable to do something. He cannot do something which we have to hear in the audio. Question number 6 says the clinic initially suspected dash before the diagnosis gout. So here it says that they are suspected something condition which they when they go to the nearby clinic before they diagnose the gout. So here there are some sequential expression is there initially and suspected means they are just assuming that diagnosis. So here, the patient is saying that, but anyway, in the audio, the pain didn't get better. In fact, quite opposite. I started to get frightened because I thought it might be sign of something really serious. It was excruciating. Here, the patient is saying what type of pain he is feeling. So the answer for the question number four is excruciating. Next, the question 5, it says that he was unable to do something. So here it says it in the last second line, I was in too much pain to drive. They are paraphrasing this that I was too much pain in to drive means he cannot do drive because he is in too much pain. So the answer for the question number 5 is he was unable to drive. As for question number 6, it says that clinic initially suspect that dash. So here it says in the second line that if it could be septicemia, means the clinic where they go for an emergency, they suspected that it could be a septicemia. So the answer would be septicemia. In the fourth question, the patient is describing. So before the audio start, we have to think what type of pain he is feeling. Saying for the fifth question, we have to just assume that what kind of thing he cannot able to do while he was in pain. And same goes for the fifth question. There is some sequential expression. As we told that we have to note it, we have to keep that in mind that there are some sequential expression in the question before we are write any answer. Yeah, that's all for my part for the question number 4, 5, and 6.
Thank you, Divya, for your nice explanation regarding the fourth, fifth, and sixth answer. She has well explained how to describe the name, then the sequential expression. Then in that we can find out the suspected conditions. Everything she has well explained. Thank you once again. Then I would like to call upon me to present the seventh, eighth, and ninth question. Welcome, Rubali.
Hello, good evening, everyone. My name is Rupali, one of the OET aspirant. First of all, I want to thank Edu Skills faculty for providing me this opportunity. I have been given 3 questions to explain question number 7, 8, 9. So before moving to the slide, I want to tell you we can easily score 23 or 24 marks in listening part A, it will listen to the audio carefully. So in listening, concentration is very important. While listening to the audio, we should not think anything else. Just listen the audio. So now we will see how we got the right answer for question number 7. So in the beginning, before audio starts, we get 30 seconds to read or highlight some keywords. So in question number 7, I highlight some keywords like previously or pain, which is less intense. So while the audio is playing, we need to focus on when it talk about the previous event. If we see the transcript here, it is written, doctor asking to the patient, have you ever felt this kind of pain before? Patient answered, like, I remember that in the winter I play quite a bit rugby, and sometimes I did get some soreness in the same place the day after. So here, soreness is related to pain, and this sentence I remembered that in the winter. So it is related to the past event. So here, patient is telling about his previous event. So while after playing rugby, he felt same pain, but which is less intense. So here we get the right answer. Answer is rugby. This is for question number 7. Now we move to question number 8. So in question number 8, here they talk about treatment, a treatment which is already received by patient. So here patient receive treatment which is not effective. So here you have to keep in your mind something that is not effective treatment. When you listen the audio, so here, well, at the first, the doctor at the clinic suggested I took some anti-inflammatories, but I can't say they made much difference. So here it is the connector. So connector, just like we focus on connectors in reading, they also help us find out the answer in listening also. That's why whenever a connector appears in the audio, we should pay extra attention to it. So here it is written after connector, but I can't say they made much difference. It means anti-inflammatory not effective. So here is the right answer is anti-inflammatory. So this is for question number 8. Now we move to the question number 9. So question number 9, here they talk about drugs, which is colchicine. So colchicine drug caused some adverse reaction. So here how we can find out the right answer. If you see the transcript here in the last line, a patient telling when he take this drug colchicine, it gave a full diarrhea. So that dealt with the pain better, but it gave me awful diarrhea. Here they talk about adverse reaction. So we need to focus on whether this drug has caused any adverse reaction. So we have to focus on the adverse reaction. Then we will get the right answer for this question. This is my part. Thank you so much.
Thank you, Rubali. You have done your part well. You have well explained about 7th question, 8th question, and 9th. Thank you, Rubali. Then I would like to call upon Malini to present 10th, 11th, and 12th question.
Good evening. I am Malini, one of the OET aspirants in the Edu Skill. First of all, I would like to say thanks to Father Salim Joseph and all admin panel for giving for this opportunity to me. Now we have 10, 11th and 12th question. 10th question, they are asking dash caused nausea. In the bracket, they mention may have overdosed. So in the script, patient is telling, I have never it again, and then I had a really bad attack. I think the doctor had got this stage where she has already giving me really powerful medication. Means powerful medication, they are mentioning liquid morphine. Here liquid morphine caused by nausea, they mentioned to take. So he patient feeling quick sick. So quick sick is that is a one of the side effect. 11th question is dash quite effective means here which one is effective means use the patient is got any uses in anything. So the patient is telling her GP is tell ice pack to put. So that time it made it bit of difference means bit of difference means it synonyms is it is effective. So next is 12th question. Allopurinol caused dash. They asked some causes means they mentioned after the ice pack it is a bit differences but you cannot have it on all the time. So anyway after the sheeted let's try allopurinol see how you get on with that. So I started taking that but I would not get it within. It gave me a skin rash. So I rag her up. Though that medicine is caused to skin rashes. Thank you.
Thank you, Malini, for your nice explanation. She has dealt with question number 10th, 11th, and 12th. In this also, in the 10th question, caused by something, the cause and effect. Then 11th question, the question itself is telling which one is effective than medication. So we can guess the answer. The answer will not be a medication or other thing. That is ice pack. Then the 12th question, also some advice reaction. Thank you, Malini. So today's discussion over. Thank you all for the nice explanation. Jocelyn, Sudha, Divya, Rupali, Malini. Everyone done their part very well. Thank you, one and all.
Thank you, Sonia, for your wonderful coordination. You did it very well.
Thank you, ma'am.